Hello, my name is Rod Lochala. I serve Unity Health as Chief Medical Officer, and I'm here today with Dr. Elizabeth Underwood, who is a clinical pharmacist for Unity Health, and we want to discuss and update you on COVID-19 vaccines. Dr. Underwood, today we're one day out of an emergency use authorization from the FDA for the Pfizer vaccine. Can you explain a little bit what that is, what that means?
So an emergency use authorization by the FDA is an approval that they'll put out while a drug is still in clinical trials because they believe that the available evidence supports its use with minimal risk and side effects. So in this case, the available evidence does suggest a high degree of immunity available with this vaccine during the current pandemic.
We're expecting to get COVID-19 vaccinations in our organization as early as Sunday, maybe Monday or Tuesday. Can you help describe to the associates what we've done as an organization to try to prepare to receive these vaccinations?
So we've got a team of associates that's been meeting for several weeks now that includes multiple disciplines to plan to receive this vaccine. This vaccine has a lot of specifications from Pfizer, not only with how to administer and prepare the vaccine, anticipated side effects, but also storage. Many of you have probably heard about the ultra low temperatures required to store this vaccine for stability purposes. And so we spend a lot of time here at Unity securing that kind of storage, getting it up and going, and working on our processes, not only for storage, but also to get this vaccine out and available to as many people as possible.
That's really good to hear, and I want all of our associates and teammates to know that members of the pharmacy, our pharmacists, will be reconstituting this vaccine and ensuring the safety of delivering this vaccine. So our pharmacists are going to reconstitute all the vaccines to prepare them for the nurses to give the shots. Dr. Underwood, can you tell us a little bit about side effects?
Sure. So side effects is one of the more frequent questions that we're already getting. The most common side effect reported in the clinical trials so far was mild to moderate injection site pain. So you get the shot and your arm's going to hurt, most commonly in those first few days. Fatigue and headache were also commonly reported, but a very, very small percentage overall was severe.
I see in the emergency use authorization they talk about the need for 2 injections. You're going to receive 1 injection and then another one for the Pfizer vaccine in 21 days, Moderna vaccine in 28 days. Why do I need 2 shots? What's the importance with that?
So the way these vaccines were developed, especially with these first few that are coming out, both of those shots are required for full immunity. And when I say full immunity, what they saw in the clinical trials was upwards of 90%, 90, 95%. So when you get that first shot, you do get a degree of immunity, but not the full amount until you get that second shot. So it's going to be really important for people to make sure they do follow up and get that second shot.
There's been a little talk about, going back to the side effects, there's been some talk about departments staggering when they get this injection. What's your recommendation with that?
Yeah, I think that's a valid question, and everyone's different. You know, some people, for example, when they get the flu shot, every year are going to say, you know, I didn't feel great. And then some people like me, it never bothers me. So it is definitely worth considering for associates to not all go and get their shot on the same day with this vaccine as well. So if you work in a certain department, don't gather up all your friends from your department and go at the same time, but maybe consider, you know, some of you getting it on one day and some of it on another.
That's good to know. I remember on some of our Arkansas Department of Health phone calls that Dr. Delahaye was very specific in encouraging all teammates in hospitals to be vaccinated, not just doctors and nurses, but environmental services, dietary. All teammates are vital to the healthcare system throughout the pandemic. Can you mention anything about that?
That's right. So here at Unity Health, we anticipate getting enough vaccine to be able to serve all of our associates. And it is so important for the hospital to run and to function for all of those associates to be here and be available for work. And excited that we feel like we're going to be able to offer it to everyone, not just the typical first line people you think of, like the nurses and the physicians, but every single important person in this hospital, which is every associate.
Absolutely. When we receive this vaccine, we're going to get a card, and it's going to be important that we keep up with this card. There's going to be a QR code on there that is going to be how the FDA helps track side effects. It will also send you reminders for your second vaccination. So it's just going to be important to know that we're going to have one more card, but it's going to be an important card. They're going to recommend that we take a picture of it with our phones and be ready for this second shot. Dr. Underwood, do you have any recommendations regarding pregnant ladies and this COVID-19 vaccine?
That's one of the other common questions that we've gotten so far, and obviously that's a question that's relevant to me. Pregnant women were not included in the clinical trials for the vaccine, so it's important if you're considering this, either to protect yourself or to protect those that you love who may be high risk, to have that conversation with your OBGYN, and so that they can evaluate the current recommendations from the American College of Obstetrics and Gynecology as well.
Very good. You know, one thing that I think is very important for everyone to understand about the COVID-19 vaccine is that vaccinating everyone is truly to protect those that are at high risk of a severe outcome. You may be a younger person with no past medical history. You may be an older person that is more at risk, but we all need to get the vaccine so that we can help protect those who are at risk of a severe outcome. If you're 25 years old and at low risk of a severe outcome, we still want you to give every consideration to taking the vaccine, because you may have COVID-19 asymptomatically and spread it to someone you care immensely about that is at high risk of a bad outcome. And so the vaccine is one of our ways forward. It is a key step forward in getting through the pandemic. And Dr. Underwood and myself and the team at Unity Health, we have continued to read and educate ourselves on these vaccines and where they are. And we want to give you updates as they come out. So expect to hear from us again in another couple of weeks, and we hope we have more exciting news to share. We may know of more side effects to share. We may all have a better comfort level with this vaccine, but we want to be completely transparent with everyone at Unity Health and our community about the vaccines, about the importance of vaccines, and really that it's an important way out of this pandemic.
That's right, and a great example of that transparency and those updates, we can already look at what's happening in the United Kingdom. So they've approved the vaccine and are already giving it there, and there have been 1 or 2 case reports of patients who had a history of significant anaphylactic reactions who did have a reaction to this vaccine. And so right now we're recommending, if you have a history of significant anaphylactic reactions, if you carry an EpiPen with you at all times, this might not be the vaccine for you. So we're going to encourage you to hold off on this vaccine with hopes that some of the other ones currently in phase 3 trials but farther down the pipeline may be better options for you.
Very good. Well, thank you so much for watching our video. We will update you hopefully in the next couple of weeks as more information comes out.